Hello, everyone. Welcome to our review class. This time we focus on rheumatoid arthritis, the TCM patterns. Let's ask Mom Trix to join us. So, rheumatoid arthritis, from a Western medicine perspective, has the following manifestations associated with some. That means you have to mention the local symptoms that are present around the affected joints.
So there's pain, swelling, tenderness, limitation of motion in affected joints, morning stiffness, and deformity.
Actually, pinaka-significant dito is the morning stiffness.
Deform.
Yeah.
Uh,
Pagising niya, masakit, hindi niya maikala. Buti naman wala pa ako niyan. Sana hindi mangyari. Morning still. Tsaka may deformity. Nagde-deform.
mm-mm.
Look at your joints. No?
Yung tsahin
Okay. What is the main etiology of rheumatoid arthritis?
Infection and autoimmunity.
Okay. What is the main pathology? So, kung pinakita dito yung synovium.
Inflammation of the synovium
Yes.
joint.
What are the general symptoms of rheumatoid arthritis? General symptoms.
Fever, weakness, easily fatigued.
Okay.
Fever, weakness, easily fatigued.
Very vague siya, no? Fever, weakness, easily fatigue.
Mm-mm.
General na general. Para lang wala, except for the fever. Saka madaling mapagod. What is the pathology? Okay. This time, we talk about RA with dump B syndrome. Okay, so what is being asked here? Ano ang pathology? What is wrong here? So this is RA due to dump B. So if you really consult a good TCM practitioner for rheumatoid, i-determine niya anong klase yung ano yung pattern ng RA mo. So what is the
Mm.
yeah.
So,
is
pain with a heaviness sensation in joints and muscles, which can be relieved by warmth and pressure, swelling of the affected joints, and fever.
Yes. So the key word is heaviness. Okay, you ask the patient, do you feel heavy? And then when you look at the joints, they're swollen and they're hot.
Mm-mm.
Okay. What about if the RA is wind P syndrome? Wind.
Mm.
Kanina damp. Ito naman wind.
Mm-mm.
Yeah.
There's wandering pain in joints and muscles. There's also fever, sensitivity to cold, a thin white tongue coating, and the floating soft pulse.
Okay, pag sinabi mong wind, P,
One.
it's migratory. It's palipat-lipat, no? And the patient is sensitive to cold. Ayaw niya ng mayroong aircon. And also,
Mm-mm.
you look at the tongue, there's nothing unusual. Remember, when you have a thin white tongue coating, that's normal. So when you feel the pulse, it's floating and soft. Okay? What about
Mm-mm.
P syndrome? So tatlo na ha. Dump P syndrome,
Mm-mm.
wind P,
busy.
and then we have
When
heat P.
if it's heat, there's pain, redness, and swelling
Mhm.
in joints. There's also fever, thirst, restlessness, a red tongue with a dry yellow coating, and a slippery rapid pulse.
Okay. When you say P syndrome, that's painful obstruction
Mm.
syndrome. Lahat yan sila may pain. But again, a very good practitioner will always differentiate para mag-guide siya on what to do. So here, hit P.
Mm-mm.
So there is pain, there is redness and swelling. Of course, if there is heat, there is thirst, there is fever. Okay. When you look at the tongue, it's red, dry yellow coating, rapid pulse, slippery kasi may pain. No? Slippery pulse is also It also indicates pain. Okay, cold B syndrome.
Cold feet, intensive pain in joints and muscles, which can be relieved by warmth and aggravated by cold. There's also fever, sensitivity to cold, a white tongue coating, and a wiry tense pulse.
So of the four, ito yung the worst,
Wiry
yung pain, no?
Mm.
Pag due to cold,
cold.
okay? And you can easily tell na it's cold because if you apply warm compress, nare-relieve yung pain. When you look at the tongue, nothing
Mm-mm.
unusual, but the patient is
Um,
cold. Ayaw niya ng malamig talaga, and the pulse is wiry and tense. What points are appropriate for RA with spleen deficiency? Okay, obviously, pag may swelling kasi, that's dampness. So isipin mo kaagad spleen, di ba?
mm-mm.
So what are the points?
Bladder 20, spleen 1, spleen 3, and spleen 6.
Yes, very good. Bladder 20 is the back shoe of the spleen. Spleen 1, remember we just did the 5 shoe kahapon, di ba? Spleen 1 is what? Chingwell? Chingwell.
Well,
The
Well, this is where the chi bubbles, diba? You can also do spleen 3, which is the shoestring, and spleen 6 is for yin deficiency. Yes? Okay. RA with kidney
for
deficiency.
damp din spleen 6, di ba, Doc?
Yes. Ito naman, RA with kidney deficiency.
Bladder 23, kidney 3, run 4, run 6, and run 8.
Okay. Bladder 23 is the back shoe of the kidney. So pag obviously, this is very common sa mga medyo maedad na, no? RA with kidney deficiency. So kidney 3 is the yen source. It's the yen source point, kidney 3, no? And then run 4 is for for the blood, for the yin, sea of blood, diba? Run 6 is for the chi, and run 8 is you don't
sabi ni ni Iron 8 daw level no acupuncture.
No needle. Pwede, pero parang very,
no.
Pwede ba?
1.5.
Uy, wag mo ini-needle. Wag mo ini-needle. Pag nanlalamig siya, lagyan mo lang ng moxa. Moxa box. You never needle run 8. Okay? Am I back? Yeah. Am I clear?
Diba? Parang 0.5 or less.
Okay. Pwede siguro, pero wag mong tutusukan yung RN8. Okay. Let's now go to points for
Or Boston.
lung deficiency. Pag lung deficiency, may shortness of breath. Ano pa ba? Medyo malamig yung kamay.
Cough.
At yung problema, yeah.
Tama.
Points.
Bladder. Okay.
Points. Hindi ko marinig.
Long bladder.
Nawala siya.
Oo, grabe.
Oo, nawawala siya.
Iyan, wala pa ako.
Can you hear me, Doc?
Yeah, I can hear you now. But you were like,
Yan.
yan,
Can you
okay.
hear me now?
Huwag ka na gumalaw. Okay, let's go to the next one.
It's not me.
RA with liver deficiency.
Liver. Okay. Bladder 18 and liver 3.
Very good. Okay, rheumatoid arthritis from a Western medicine perspective, ano yung mga general symptoms?
Local symptoms or other symptoms, lab tests and radiology.
Fever, weakness, kanina we
Ano
discussed
rin?
fever, yeah, easy
Ano rin?
fatigability,
Bakit iba yung,
anorexia, walang ganang kumain, weight
bakit
loss.
iba yung sagot?
Bakit iba? Then other symptoms, ito yung other symptoms. Rheumatoid nodules, rheumatoid vasculitis, osteoporosis. Okay? So, maghahanap ka ng mga nodules, um, inflammation ng blood vessels, osteoporosis. Can you hear me? Yeah. Number
Ano?
15.
Kaya pala siya. Okay.
Okay, laboratory tests.
Lab test. Okay.
The rheumatoid factor and the ESR. No? So you don't have to bother with this. This is for the laboratory. Okay, radiology. Ano makikita sa X-ray? Ma'am,
RA. Uh, hello?
yes.
Hello?
Hello.
Yes.
Yeah, I'm here.
Loss of cartilage, bone erosion.
Yes. Okay. Rheumatoid arthritis is categorized sa TCM as what? Hello?
Syndrome. Yes,
As
Doc. P syndrome.
B syndrome. Okay.
P
Bis.
syndrome.
Pathology. You
P.
mentioned that. Grabe ang internet. Philippines.
Hello, can you hear me now?
Yes, yes.
Okay. Internal factors, deficiency of the liver and kidney, deficiency of qi and blood. External factors, invasion of the wind, cold, and dampness.
Okay, so as you can see, yung kanina kinover natin, yung external. So meron din tayong, that's why when we did the points, 'di ba, from a liver deficiency, kidney deficiency, spleen deficiency, lung, 'di ba? So yun na yun, internal factors. So if you have weak liver and kidneys, deficient qi and blood, you can also have RA. So RA belongs to one of four TCM pattern identifications. What are the four?
Wind P syndrome, cold P syndrome, damp P syndrome, and heat P syndrome.
Yes. So easy na.
Wind cold.
Alam mo na yan, Sir Mark.
Wind cold
So when
P.
you see a
Up.
patient, alam mo. I'll post this later sa group chat. Okay, WINP syndrome, ano manifestations? Hello? Ay, grabe. Hello? Can you hear me?
One word.
Doc.
Yes.
Yes, Doc.
Okay.
Hello?
Yeah, yeah. I can't hear you.
Hello? Yeah, you can hear me now.
Yes.
Hello?
Yeah. Ang wandering to, hindi to WO ha, that's wandering type. Wandering pain. WA yan.
Wondering.
Mm-mm.
Uh-uh.
Fever, tayang type, sensitivity to cold, thin white tongue coating, floating soft pulse. That was discussed earlier. Pag cold P, sige, bilisan na natin to, baka mawala na naman. Cold P, intense pain in the joints and muscles, relieved by warmth. And as we mentioned earlier, it is very painful. No? White tongue coating, white intense pulse. Then damp P, heaviness
Intense.
sensation. Yes. Then swelling. Pale tongue, white greasy coating. So, soft, slow pulse. Heat P, makikita mo may mga redness, swelling, fever, thirst, restlessness, red tongue, slippery rapid pulse. Okay, the points used are based on what?
The joints affected
Mhm.
and the internal organs affected.
Yes.
The effectiveness towards RA.
Yes. Thank you so much. We continue next week with rheumatoid arthritis.
So,
Congratulations.
pwede magtanong?
Oo. Yeah.
Dok, lang, Dok. Kasi meron ako nakikita na